Hello, I'm Ashley Westwood and I'm one of the school nurses in Walsall. I'd like to share a presentation with you around basic first aid in childhood illnesses, which is part of the Change Your Mind programme that's being delivered to pupils in Walsall. So welcome to the school nursing service. School nurses are qualified nurses who have additional training in child health and wellbeing. We work as part of a team which includes staff nurses, nursery nurses, support workers and admin staff. The school nursing team supports children and young people from reception age up until their 19th birthday. Young people who have disabilities or additional needs can also access the service and support until they're 25 years of age. The team provide advice, support and help with a range of physical and mental health problems. So some of the things we included are keeping healthy, immunisations, emotional health, weight management, sexual health, drugs and alcohol, and smoking. And you may have seen our poster which is shown on the presentation. So how can you access the school nursing service? So we operate a single point of access. We work Monday to Friday, 9 a.m. till 5 p.m. You can contact us by calling either 01922 423349 or you can text us on 07520 634 909. So we offer confidential advice and support, and our text service allows parents, carers, and to contact us anonymously. So why are we here today? So this parent workshop is part of the Change Your Mind programme. So pupils in Year 12 from Queen Mary's Grammar School have been trained as peer educators. They are delivering sessions to your child around various topics. So we would like to encourage parents and carers to talk to their child about what they have learnt in class. So the peer educators will have given your child some tips and ideas about how they can be healthier, happier, and to stay safe. They will need your support to put these into practice. We also know that parenting doesn't come with a handbook, and sometimes, as parents and carers, we need some help and advice ourselves so that we can support our child. Hopefully, these workshops will provide you with some support and some ideas about where to go for further advice. So we'll move on. We'll talk about common illness in children. So first of all, coughs and colds. So it's normal for a child to have 8 or more coughs or colds in a space of 12 months. So most coughs and colds get better within 5 to 7 days. So how can you help your child? So what to do when they're at home? So it's most important to drink plenty of fluids. Taking paracetamol if your child is in pain or any discomfort. But obviously we'd always advise you to follow the instructions and obviously making sure the product's in date. It's very important to wash their hands regularly and wash your hands regularly. So when should you go to the GP? So we'd normally say if they've had a sore throat for more than 4 days, then that's when you should be seeking support. Or if it's been a cough that's lasted for 3 weeks or longer. But when to go to A&E, so if they're unable to swallow, or if you're quite concerned about their breathing, so any breathing difficulties or problems. Moving on to diarrhea and vomiting. So this is very common. It's often caused by a stomach bug and should stop within a few days. So diarrhea usually stops within 5 to 7 days, with vomiting usually stopping after a day or two. So what can you do at home while they're with you? So stay at home and rest. Get them to drink plenty of fluids and have it in small sips regularly. Let the child eat if they want to, and get them again to wash their hands regularly. So when should you go to see the GP? So if their wee is dark, smelly, or they're not weeing as much as they normally would within 24 hours, and if there's any blood within their poo. But when should you get to A&E? So we'd normally say if there's any vomiting, any blood when they're vomiting, if their vomiting is bright green or yellow, if they've got any neck pain or stiff neck, and they're having difficulty looking at bright light. But what we would say is very important is they need to stay off school until they haven't been sick or had any diarrhea for at least 2 days to 48 hours. Rashes in children. So we'll move on to this part of the presentation. So childhood rashes are common and aren't usually a cause for concern. However, most rashes are harmless and disappear without the need for treatment. However, see your GP if your child has a rash and they seem unwell, or if you're generally worried, because obviously you know your child best. So they'll be able to investigate the cause and recommend any necessary treatment. And there is a website up on the screen that you can pause and you can have a little look at in your own time, which talks a little bit about rashes. So the times that we would say that you need to go to A&E or to call 999 is if your child has the rash, and they also have things like a stiff neck, they're bothered by lights, they seem confused, they might be shaking uncontrollably, they may have a fever that you can't control, so not coming down with any pain relief such as paracetamol. They may have unusually cold hands and feet, and they have a rash that doesn't fade when you press a glass against it. They also can be signs of meningitis, but not wanting to worry you. We're going to move on to sepsis. So what is sepsis? So it's a life-threatening reaction to an infection. It happens when the immune system overreacts to an infection and starts damaging your body's own tissues and organs. You cannot catch it from another person, however. Sometimes it's known as septicemia or blood poisoning. It can be quite hard to spot, and there are lots of possible symptoms. Symptoms can be quite vague. They can be like symptoms such as other conditions like a flu or a chest infection or anything like that. It is a life-threatening condition. It can be hard to spot, especially in babies and young children. But again, if you think you or someone has this or the look or symptoms of sepsis, then it's important to call 999 straight away or go to A&E. And again, we would say trust your instincts. So some of the symptoms in any child can be they're breathing very fast, they may have had a fit or convulsion, they look mottled, bluish or pale, they may have a rash that does not fade when you press it, they could be very lethargic or difficult to wake, so just really tired, they may feel abnormally cold to touch. A child under 5, it could be that they're not feeding, they're vomiting constantly, repeatedly, or they haven't had a wee or wet nappy for 12 hours or more. So these are just some of the signs and symptoms to obviously look out for. We'll move on to infection control and prevention. So this includes hand washing. So again, washing your hands properly is one of the most important things that any individual can do to preventing the spread of many illnesses. And you would have seen the slogan for COVID at the moment, which is the hands, face and space. There is a link on here for the ebook, which has lots of different activities and talking around different things similar to this, like hand washing. And what I would say is the hand washing, there's the 5 main steps for children that they need to follow. So step 1, which you can see on here, is for them to wet their hands under warm water first of all. Then they need to put some soap on and obviously be able to clean and get rid of the germs that they've got. They need to be able to rub well for at least 15 to 20 seconds. So they need to make sure they're getting all their fingers, the backs of the hands, the thumbs, the wrists, and really giving it a good wash. And then they just need to be able to wash those soap suds under warm running water, and then obviously dry their hands with a clean paper towel or a towel, obviously if it's at home. Okay, so we're then going to move on to childhood vaccinations. So all children are offered immunisations to help protect them against some diseases such as measles, rubella, tetanus and meningitis, and these are all free of charge. Babies will have their injections at the GP surgery, normally between 8 weeks and then 12 months, and the booster before they start school. So the next routine immunisations are delivered then in secondary school. So in year 8, they will have the HPV vaccine, which we'll talk a little bit more about. And in year 9, they have a booster for tetanus, diphtheria, polio, plus meningitis C. The flu immunisation is offered each year as well in certain school year groups. If you think your child may have missed a vaccine, then it's important to speak to your GP. So there is a bit of a link which we'll be able to share with you, but I'll just read it out for you guys. So it's for the HPVs, HTTPS with a dots, there's double slashes. It's www.nhs.uk/conditions/vaccination/human-papillomavirus-vaccine-. So the HPV, so it's the vaccine is for girls and boys aged 12 to 13 years are offered this as part of the NHS vaccination programme. It helps protect us against cancers caused by HPV, which do include cervical cancer, some male and throat, head and neck cancers, some cancer of the anal and genital areas. It also helps to protect against genital warts. In England, girls and boys aged 12 to 13 years are routinely offered the first vaccine when they're in school year 8. The second dose is normally 6 to 24 months after the first dose has been given. It's important to have both doses to make sure that they're properly protected and vaccinated against. Um, we'll move on a bit about the flu nasal spray vaccine. So who should have this? The nasal spray flu vaccine is free on the NHS, and this is for children aged 2 or 3 years on the 31st of August 2020 or born between the 1st September 2016 and August 2018. It's also for all primary school children, reception to year 6, or year 7 children in secondary school, or children aged 2 to 17 years with long-term health conditions. So if your child is aged between 6 months and 2 years and is in a high-risk group for flu, they'll be offered a flu vaccine injection instead of the nasal spray. This is because the nasal spray is not licensed for children under 2 years. Children aged 2 to 17 years may also have the flu vaccine injection if the nasal spray vaccine is not suitable for them. Okay, just going to move on to first aid and where to get help. So, what can you do as a parent in an emergency? So we've got a bit of not a demonstration, sorry. So a presentation here from the St John's Ambulance. So again, it's very basic, guys, but it's what to do if your child has stopped breathing. So the most important thing, if you think your child's unconscious, is to try and call 999 as soon as possible, or 112 for emergency help. So if you're alone, we recommend giving 1 minute of CPR before calling on a speaker. That's just, obviously, that's the most important thing, really, to make sure that they're okay before making that call, but you want to make the call quite quickly. Number 2 is breathe. So you want to be opening their airway as dictated by the picture in the presentation. So to do this, you can pinch their nose firmly. So you need to pinch their nose firmly closed, and then be able to put your lips around their mouth and blow steadily until you can see their chest rise. And what we would say is give 5 initial rescue breaths for children. So pump action 3, which is using the heel of one hand in the centre of the chest. And that's to give 30 chest compressions at a rate of 100 to 120 per minute. But don't worry, obviously, if you're on the phone, the ambulance crew or whoever it might be that's on the phone will be able to guide you as well as you're doing this. Section 4, which is repeat. So it's give 2 rescue breaths followed by 30 chest compressions, and then continue with the CPR until someone else comes to help and arrive, and I'll let you know when to stop so that I can then take over. So the 2 rescue breaths is very important with children, because normally it's more likely to be a respiratory condition than a cardiac arrest with children, normally due to the airway. Okay, so what to do if someone is choking? So the first step would be to try and encourage the person to cough. So by talking to them and actually trying to get them to cough. Step 2, if that's not successful, will be what we call slap it out. So it's quite sharp back blows between the shoulder blades. So it's obviously normally 1 at a time. So once you've done 1, obviously looking to see if whatever it is, the obstruction has come away. Obviously, if not, it's doing up until 5 times unless it hasn't come out. If not, we call squeeze it out. So it's giving what we call 5 abdominal thrusts, and you can see that in the picture of how to do that as well. And again, what we would say is, if they're still choking and you're not having any luck, is to call 999, who will be able to, or 112 to support you with that as well. And obviously it's important to talk to the person and explain what you do in it, and obviously that until help arrives. Okay, just going to move on to the next section, guys. Excuse me. So the next one is choosing well and getting the right help. So again, most common childhood illnesses do get better with time and with a bit of TLC at home. There are lots of professionals who can help if you've got any questions or if you're just a bit worried. But remember, the most important thing, A&E 999 emergencies only. So we've got this little bit of a guide here about where to seek help. So self-care, so for things like a grazed knee, a sore throat, a cough, make sure you've got medication like paracetamol in your cupboard. When to call NHS 111. So if you're unwell, your child's unwell, you're a bit unsure what it might be, the GP surgery's closed for an evening or a weekend, or you might just need a bit more help. So that would be where we'd say the NHS 111 phone call. Pharmacy you can get to for things like diarrhea, runny nose, painful cough, a headache is a few examples. when to go to the GP surgery, so things like vomiting, ear pain, stomach ache, or things like backache. And obviously more serious things for A&E or 999, which we would say obviously in emergency only, would be if the person or the child is choking, they have any severe chest pain, or any chest pain which I'm worried about or you're worried about, they're blacked out, or they might have some blood loss. That's why we'd recommend going to A&E or calling 999. Okay, I'm just going to move on to the next section, guys. Oh, just bear with me. Yeah, so a bit more information. So we've also got some websites which provide lots of fun, games, blogs for different age groups, and these are aimed at children but also parents as well. So we've got the Health for Kids, which you'll see the link there, and the Health for Teens. So Health for Kids saying more at primary age children and their parents, and Health for Teens is more aimed at secondary age school children. Health for Teens has lots of different games, as you can see by the pictures that the children can play, which learns them all about their health and things like talk about today, like common illnesses. Whereas the one for Health for Teens is similar, but obviously that secondary age child. Okay. So if you do want to contact us or get more help about some of the things I've talked about today, or anything else regarding your child's health and well-being or their emotional health, then please contact us. And again, there's numerous ways that you can do that. So we've got the email address, which is on the screen now. We've got the single point of access number, which I've already mentioned, which you can call in on. We've got the text number, which is called Parent Chat Health. We've also got our Twitter account. Again, we've got a web page which is on there, which has got lots of information as well. I've already mentioned that we've got the websites for children and young people. So again, please contact us for any advice. But you can also contact schools, as they've got lots of information about who we are and also how to contact us, as they make a lot of referrals to us. And the last page is the thank you for listening and any questions. Again, it's a bit more difficult to obviously ask any questions, obviously at the moment, which I can't do. But if you have got any questions or you want a bit more advice, then don't forget to give us a telephone call, an email, or a text message. And again, thank you again for listening. I do really hope that it's been helpful. Thank you.